name is Lindsay Cochran. Welcome to This Week in Recovery. Before we get started, I'm a member of the Lackawanna Recovery Coalition, as well as a recovering family member myself, and I also work as a family counselor at a local treatment facility. Joining us today, we have Executive Director and Licensed Social Worker Bill Stauffer to discuss recovery in the age of COVID. Hey, Bill.
How are you? Good to be here today.
Thanks for joining us today. So, Bill, if you're comfortable, tell us a little bit about your role with the Pennsylvania Recovery Organization Alliance.
So just starting, first and foremost, I'm a person in long-term recovery, which means to me, I've not had to use a drink or a drug since October 1986. I actually sometimes refer myself as a formerly young person still in recovery. So I spent most of the last 3 decades doing this work, and I've run residential programs and outpatient programs. And since 2012, I've run the Pennsylvania State Recovery Community Organization. And a recovery community organization serves the entire community. And so at the state level, we're working to bring together other recovery community organizations and like-minded people to change the way that the public identifies addiction. We want people to understand that there are a lot of recovering people out there in their communities, and that we're a people who are involved in good citizenship. We go to work, we take care of our families, and recovery should be something that's encouraged. In that role, I've done a number of different things related to workforce development. I've had the opportunity to testify in front of the U.S. Senate on issues related to substance use and aging. I helped set up a hearing in the Pennsylvania General Assembly on the lack of adolescent services in the state of Pennsylvania, and a number of different things. So it's been a real honor and opportunity to bring together people and to move us forward in a way that that every Pennsylvanian who has a drug and alcohol problem can know that there is hope out there, and that there's access to services and support wherever they are in Pennsylvania. So that's when I wake up at the beginning of every day. That is my focus, and it's a great honor to be able to do that.
Absolutely, absolutely. So, given your experience, and one of the pressing issues that we're seeing today in these last couple months is the issue with COVID-19. In your opinion, how do you feel the pandemic with COVID has impacted the recovery community?
You know, it has been pretty complex, and as you are probably aware, recovery is often about community. No matter what pathway that you have, most people I know in recovery identify as being a member of a recovery community, and they identify that they have support and assist them in their recovery process. That can take a lot of different forms. It can be a 12-step support group. It could be a non-traditional support group. It could be church. But connection is critically important. So when COVID-19 hit, what happened with the shelter-in-place orders in a lot of our communities is that physical connection, the ability to sit in a room and feel like you're with people who understand you and support you, and be able to express yourself face-to-face, was removed. And that put a lot of different people at risk, because they didn't have a place to go to get that kind of support. I'll say that, you know, this is a story of a story of great pride, because I'm involved nationally, and what a lot of us did here in PA and nationally is jump into gear, and so the vast majority of support out there moved everything online very, very quickly. So by the end of the first week, when this happened in mid-March, there was just a tremendous amount of support, treatment, and recovery services that had moved online, so that people could access care. And you know, a lot of us did things like make sure that we put all the resources that we could together so that people could know where they would be able to get hope, and those kinds of things. So the first chapter of this was a story of the community responding to its own needs. And I think it's a story that needs to be told in greater detail, because I don't think the general public knows about it, but a lot of people worked really, really hard to make sure that there was at least the minimum disruption of care as possible.
Right, and you had mentioned moving everything to online access is, you know, the community being a huge factor in the recovery environment and being able to have that direct contact. And I know, you know, stemming back to March when things moved really quickly, to be able to still provide those resources. So someone engaging in any type of recovery program, what resources are available as far as Zoom meetings and telehealth, telemedicine, things like that?
Most of those services are available. So like on our website, we have listed every type of recovery support. There's Buddha related recovery support. There is 12-step recovery support. There's all kinds of different recovery support that are available. And we found every one that we could think of or locate and put them all online. So almost everything is currently available online. You know, and I think that that's a real asset. But the other part of this is that it also involves some challenges. And so actually one of the reasons that I was fairly involved in this is that one of the things that I do is help Faces and Voices. They're the national recovery organization. I developed a 3-day training for them on providing digital services online. And I most recently did that in Texas over the summer. And so there was a demand for those kinds of trainings so that people would be able to take care online. And so, you know, I was providing that in Puerto Rico at the end of the first week through a digital connection. So we have put all these things out there, but we also noticed that there were challenges. For example, you know, for someone like me who's in long-term recovery, and I know the people that I'm connected to, being in a chat group or a Zoom meeting with them, these are people that I know and I already feel connected to. So sometimes for a newcomer, that can be a little bit difficult. So, you know, we are thinking now and about moving forward about how to help someone who may be newer feel more comfortable. I could put you some writings. I wrote a paper with a guy named Bill White, who's a nationally known writer, on who gets left behind. And so sometimes people in rural communities with not so great internet access or phone service may have difficulty accessing online services, or some people who simply aren't that familiar with the resources or how to access them. So we're going to need to make sure that moving forward that we have better access for people who want these services. And you know, a lot of discussion has happened in the recovery community about whether these services are beneficial or there are some risks with them. And I think overall the consensus is that absolutely they're beneficial. They can be more convenient. People can go to a meeting at any time of the day or night because they're all over the world. You know, you could sit in a meeting with people from Australia if you wanted to. But also some people that may not feel as comfortable with it because of the, you know, there's things like internet lag. And so, you know, seeing other people's facial expressions and feeling like you're truly connected to people, it could be a barrier for some, while other people who may not be comfortable with a face-to-face connection, that they may be embarrassed to talk about having an addiction, the online services are a good way to make that initial transition. So we do have some ways to go, but I suspect that what's going to happen moving forward as COVID-19 dissipates, which although I hope it will be soon, I kind of suspect it will be a while, is how do we incorporate and integrate telehealth services in ways that we get the most benefit out of them, and also be cognizant of the kinds of things that they may not work as well for.
Right, absolutely. And I think one of the things that is a great fact that you pointed out is, you know, stemming all the way back to hope. And with the quarantine and the isolation and the individuals who say are not working or don't have access to additional resources out in the community, they're still able at any point, at any time, regardless of location, to access some kind of a resource. You know, and even like you had mentioned, the comfortability that's associated with long-term recovery and already having established those relationships is one thing, but it can still be an option for someone who's new to the recovery program, regardless of what the program might be. As far as turnout, have you seen a large turnout with the recovery community taking advantage of these resources?
Yeah, it seems that they are, they've been very well utilized from different groups that I've talked to around the country. So there are a lot of people using them. There are also still people that want to have face-to-face services. And so, you know, we're hearing about people doing 12-step meetings or other recovery support meetings in parks where they can maintain social distancing and stuff. So, you know, this is part of a story of a community working it out so that we can keep each other safe and support each other. You know, I mentioned a few minutes ago about how some people may not feel comfortable, or if they're new, may not make those kinds of connections. And we're hearing of groups that when they identify somebody who's brand new, they'll take extra time and call the person, you know, offline so that when the person gets onto a Zoom meeting, they feel comfortable with at least some of the people in the meeting, so they're more likely to engage in that. So, you know, I'm proud of the community because we tend to figure things out. You know, facing a barrier or an adversity doesn't seem to slow us down much because our primary mission is to help another person with an addiction problem get into and stay in recovery.
Right, and I think looking at the time frame from March until now, just seeing the progress that's been made, and like you said, you know, quick problem solving on the spot, just trying to pick up on the quirks and things like that, moving through the program, you know, and seeing how things are working, what's lacking, what's working, and trying to make those changes to adapt and to be able to incorporate something for everybody, you know, and even just not even as far as the meetings and the things like that. I know from my standpoint, from a residential perspective, being able to see families still engage with their loved ones while they're still in treatment has also been really helpful because it keeps that connection going. And for those who can't travel, or, you know, who are at a stay-at-home order and cannot leave their homes, don't have access to some of those resources, you know, it's been a great asset to have inpatient as well as outpatient.
Yeah, very true. You know, and some of the things that I think will need to be worked out moving forward is in response to the pandemic, several departments of the federal government eased their standards on telehealth services, and the state responded in a corresponding manner. But, you know, a lot of the, like, so this Zoom connection, most Zoom connections are free. If you were to get a HIPAA compliant Zoom connection, there's actually a charge. And some of these things can be somewhat expensive. They're important because they make sure that they're protecting patient privacy and things like that. So I think one of the things that we're going to have to think about moving forward is where are those balances, and making sure that that people who are accessing services can be assured of their privacy. And so looking at those telehealth standards, as well as how services are billed for, because a number of the drug and alcohol services prior to COVID-19, you simply couldn't bill for them as a telehealth service, or you couldn't bill for them in ways when you were conducting other similar services on the same day. So those are the kind of things I think also that will need to be worked out.
Yeah, exactly. And I think looking at, you know, all of, again, what's been done in the short amount of time that we've been given from March until now, and just seeing the progress and the engagement from anyone involved in the recovery community in all different kinds of settings, really all over the world, because we've all been impacted by this pandemic. And I think moving forward, the recovery environment is not going to be the same, you know, but knowing that we're still able to work through some of the glitches and continue to make progress and advancements in this area, so that this is something that can grow and it's not just something that's here temporarily.
Yeah, I agree.
I know earlier you had mentioned a website. Do you have that website specifically to be able, for those, you know, if anyone is out there struggling or is looking for additional resources for themselves or for, you know, a loved one that they can get to?
Yeah, it's on our website, which is simple. It's www.pro-a.org. And, you know, I could make sure that you have it, so if you send it out. And we have a lot of different things on there, including support services, information about telemedicine, information about depression and mental health issues, which are coming up for some people in this time. And we really put on anything that we could think of that people could make use of.
Which is great. And I'm glad that you mentioned, the co-occurring aspect of things, because when you see an increase in substance use, you also see an increase in mental health disorders as well. So it's great to be able to know that there's resources available for both, and thank you so much, Bill, for being able to provide us with those resources and also for joining us today.
Oh, sure. And like for your viewers out there, listen, if you're struggling right now, this is a really stressful time for almost everybody. Well, actually, everybody. Nobody's lived through this before. So if you're feeling stressed out, reach out for help. If you're early in recovery or struggling, get some help, because we've all been through it. And it's just a matter of continue to seeking help. And if you do, your recovery will work, so just never give up on yourself. Bet on yourself in recovery, and this all works out. So it's an honor to be here today. Thank you.
Thank you again, Bill. And thank you everyone who joined us today. And we're all in this together. Like Bill had mentioned, if you're struggling or looking for resources, please reach out. That's what we're here for. We're all in this together and here to help one another. Thank you, everyone.